Hello, good evening, and thank you for joining us. We will get started in 1 minute. Make sure you have your cafecito, water, tea, whatever you like, ready to engage in this conversation. If you're joining us through Facebook, don't forget to click share, invite your family, invite your friends, and we'll get started in just a minute. Hello, everyone. My name is Jennifer Reyes. I am the Health Programs Coordinator for the League of United Latin American Citizens, also known as LULAC. We are the largest and oldest Latino civil rights organization. The mission of LULAC is to advance the economic condition, educational attainment, political influence, housing, health, and civil rights of the Latino community of the United States. Today, we are joined by some great guests to talk about some very important topics. Today, we will discuss breast cancer and the barriers faced in access to quality healthcare, how to attain reliable health resources, the importance of representation in health research, and we will introduce the All of Us research program for those of you who may not be familiar with the program. And again, if you're joining us through Facebook, have your tea ready, have your drink ready. And if you have any questions, drop it in the Zoom chat or in the Facebook chat. We have someone on the Facebook chat and they'll be ready to send the questions in through here so that I can ask the panelists. But before we get started, I would like to ask everyone to pull out their cell phones, open up your camera, and then scan the QR code. And Liz will be dropping it in the chat as well. Yeah, there we go. And it's just a quick 3-question survey. It should not take very long. So I'll just give you a minute to do that. Okay, so thank you for completing the survey. It's just to help us get a better understanding of, how to have future conversations where we can focus more on. If you haven't heard of the research program, yeah, so thank you. Okay, so breast cancer is a disease that affects women, men, non-binary people. 1 in 8 women, that's about 13%, will be diagnosed with breast cancer in their lives. Breast cancer became the most common cancer globally as of 2021, accounting for 12% of all new annual cancer cases worldwide, according to the World Health Organization. As of January 2021, there are more than 3.8 million women with a history of breast cancer in the US. This includes women who are currently being treated and those who have finished treatment. It's important to have an intersectional approach as we address the systematic disparities in healthcare due to race, class, income, education, and immigration status. That's why we are joined today by some great guests who will be engaging in this important conversation. So I would first like to introduce Ingrid Valencia Marin. Hello. Ingrid is a breast cancer thriver, born in Colombia and now living in Iowa City, working as office manager for the National Network of Libraries of Medicine, All of Us Community Engagement Center. She's also a fitness instructor and a wellness coach. She's passionate about sharing her journey with cancer to inspire others to take responsibility for their health and well-being. Ingrid, thank you so much for joining us today.
Thank you, Jennifer, and thank you, LULAC, for this invitation. It's a pleasure for me to share my story with you.
Yeah, so I want to begin today's conversation by asking you to share a little bit about yourself and your experience with breast cancer.
Well, where should I start? Well, you already said, I wanted to disclose that even though I work for the National Library of Medicine, I'm here to share my story with breast cancer. I and all the lessons learned through my journey and how it made me a better person and opened myself for a lot of new possibilities. So I guess I would start first by the biggest lesson that I've learned when I first was diagnosed. Let's see, let's put it this way. I was diagnosed almost 7 years ago, and I've been cancer-free for the last 5 years. So it was a challenging and long journey, but I'm thriving, like my introduction say.
Explain a little bit why you use that term thriver instead of survivor.
Well, I'm actually very sensitive to the word survivor. I think it has a big load of negative charge, even though for many people also empower them. I like the word thriver because it represents better the transformation and the change that the diagnosis made in myself. Survivorship for me brings a negative connotation because it's like something coming from something very bad. And even though cancer is something very bad, it can be like a life-changing experience. So that's why I just like that word better.
Thank you. Yes.
You have more questions. I made myself a little cheat sheet because I could talk here for years, and I know we have short time, so I better should ask, how long do I have?
Yeah. So let's transition into, can you tell us about your experience with breast cancer, like the barriers you faced?
Well, first is the walking through the medical system of the United States. That was my biggest scare, like right after the diagnosis itself, which is completely shocking. Nobody wants to hear that word, and nobody thinks that it's ever going to be diagnosed, especially in my case, because everybody thinks that is inherited. And even though it is one of the causes, it's actually not the biggest. In my family, I am the first ever in my, even from my parents or from my mother. Nobody has had cancer. So it was shocking for me. Also, as you noticed, I am in the wellness industry. So I am a person who takes very good care of herself. And, you know, I know everything about health. So for me, this diagnosis came really, really shocking. Like, why me? That's probably one of the first questions that anybody asks themselves when they receive that. And right after you receive that horrible news, is like, what is going to happen to me now? And it's unavoidable to think that you're gonna die. So it is like impregnated to many of us that cancer is synonym of death. But after you go through that, you actually know that is kind of the opposite. And the big difference is in the early detection. That's why it's so important to create awareness and all the health resources that we have to avoid it, because cancer doesn't have symptoms. Actually, when you have symptoms, it's usually not very good. So the early detection has to come with all the tools and the that the medical system has for us to recognize. And now I'm just remembered that it was because of the October month that I went through my annual checkup. And after that annual checkup, that's when the news came and the journey started.
How can we ensure that Latinos understand the importance of medical research, and how it is integral in combating chronic diseases such as breast cancer?
Well, I think one thing that is important for us, for the Latino community, is to understand things that personally I didn't know before. Is we are the advocates of our own health. And for that, we need, I forgot the word, trusted information. And because of that, in order to have trusted information, research has to be done the proper way. And for that to happen, we need to provide that information to the people that do the research. So it was completely unknown to me that all the resources and support that is out there. And we usually don't know that until very late, because I should say probably culturally is shocking to me that we expect that the doctor take us by the hand for whatever is happening. And even though there are protocols and they are there to help us, such a complex condition that just one doctor cannot tell you everything. So it's like a whole system that needs to be working together when anyone goes through a diagnosis like this one. So that's why I think it's so important for us to participate in research and to contribute to, like, for instance, because I'm such a big advocate of this, I know that what it was available for me 7 years ago, it has evolved a lot nowadays. So, and it continues to evolve. And when I talk to people before me who was diagnosed before me, they didn't know things that I was open to. So it's a continuous evolving situation, our health. And that's why it's so important that we are involved in our own health, basically. Yes.
I'm seeing a question pop up in the chat. Let me see. They ask, do we know some causes of breast cancer since it's not always genetic?
I believe there are, yeah, I don't have it on the top of my mind, but there's not just one single response for that. And actually, that's the biggest question. There are many possibilities, and there are things that can be done to prevent it. But still, there's something that needs to be researched, because cancer is a living thing, and it continues to, it is affected by too many things in our systems. It's not just one condition, one ethnicity, one age, because it can happen at any time in our lives. So I guess the short answer is not really. There are probable causes, but there's not a single one.
Yeah, thank you for sharing. I also want to allocate some time to Maria Sanchez. So if Liz, you can. So next we have Maria Sanchez. Maria is a 17-year breast cancer survivor, clinical study patient, and advocate. She has contributed to breast cancer community as an outreach manager at the now extinct El Paso affiliate of Susan G. Komen for the Cure. She is also an affiliate advocate for all public policy efforts at the local, state, and federal levels. In support of pre-existing conditions, Maria was honorably mentioned in the Senators Kennedy and Hutchinson's original Affordable Care Act bill. Maria currently represents El Paso and MD Anderson's Active Living After Cancer Advisory Council. It's a pleasure having you with us today, Maria.
Thank you very much for having me and for this opportunity to talk about what I think should be a concern to not only all men, but all women and the men in their lives, because unfortunately we continue to lose many lives, many valuable lives to a disease called breast cancer. I can tell you that the 6 famous words that I first heard 17 years ago were, you have stage 2 infiltrating carcinoma, which I later learned was called triple negative, which is not very common. It's in the 15th percentile of the types of breast cancer where hormonally driven cancers are more common. At age 41, I was very blessed and gainfully employed, but also insured by my employer with health insurance. And I think I really put it to the test with my cancer diagnosis. It was very helpful back a year before that when I made a visit to my OBGYN, and I think she became a very key player in my diagnosis because she said to me, and I'll never forget her words, and still today I thank her for that. She says, I hear your 40th birthday is coming up and I have a present for you. And she handed me my first prescription for my first mammogram. Something that I learned was very key, perhaps, to my diagnosis being caught so early, because my first mammogram became my baseline, which is the same for all of us. It is that mammogram which all others after that will be compared, because solely 12 months later was when I was diagnosed. I can tell you that after a very stressful 3 months of screening with almost 7, 8 maybe mammograms, including 3 ultrasounds and an MRI, I decided to take all my records to a different entity for my diagnosis, after realizing in hindsight that perhaps the Women's Center where I was perhaps not equipped to handle me and my condition. But it was in May of 2004 where I was fortunate at this new screening center where I had the pleasure of meeting my surgeon, Dr. Gary Shabacher. And he, after performing a biopsy and not getting clear margins, was clearly already educating me by telling me that the tumor was the size of my thumbnail. He said it was 4 fingers behind my nipple and at about 11 o'clock. To me, that became a wealth of knowledge because now I had something very tangible to hold on to give as an example of how and the very many aspects of breast cancer as an example. In June of that year, I had my sentinel nodes dissection, of which I had 2 sentinel nodes removed. And then a month later, I met a great man in my life, the late Byron Chesbro, Dr. Byron Chesbro, my oncologist. And he was very surprised that I chose him to be my oncologist, because my primary reason to choosing him was because he had a clinical study. Over the process of learning what a clinical study will entail, I knew that I was going to be part of the standard arm of the study itself. And this would include 8 chemotherapies spaced out every other week, 35 radiations, and hopefully, come out on the good side. We're 14 years as a doctor and patient. Dr. Chesbro and I learned quite a bit about each other. He learned about my outreach efforts. At that time, he didn't know much about Susan G. Komen for the Cure. So I tapped him to serve on one of our grant committees, from which he came out learning more about the efforts that Susan G. Komen for the Cure was doing locally here in El Paso, as well as what I was doing and where all of my efforts and my knowledge was coming from as well. Because as you mentioned, I had also served as a consumer reviewer for the Department of Defense, which I was reading a lot of research, some of it pertaining to even my type of breast cancer. Learning even then, back in 2009, that they were already looking at BRCA 3 and 4. Of course, as a triple negative cancer patient, I already had been tested genetically And despite, and obviously in spite of the fact that genetics is only a small portion of breast cancer, after the diagnosis of one of my nephews with leukemia, I decided to find out if he had a second factor, which would be my link. And the reason being is that I'm a fraternal twin, and my fraternal twin is his father. So I found out I was genetically negative for BRCA. So that was at least a peace of mind, but we somewhat suspected it, not only because similar to Ingrid, I do not have family history. I was already 41, and yet it was not very common to be a triple negative either. So the biggest takeaway from my clinical study, or entering the clinical study, was hearing the words from my oncologist, Dr. Chesbro, when he said, you know, triple negatives have almost certainty that they are the most receptive to chemo when caught early. And true to his word, something that I told him during our last interaction in January of 2018, was that he had been to New York and made a presentation about our clinical study. The clinical study included about 2,400 women throughout the US. And he said he had concluded that yes, the clinical study showed that triple negative patients were indeed more receptive to chemo. And I told him that I had held him to that word because it's something that really helped me not only educate others to find out the details about their cancer, the particular details, and what else they could do to learn more and to be more proactive about their own health. So addressing those obstacles that so many women face in our community, to me, is very critical to when some women may or may not choose to be part of a clinical study. But I think it's imperative for each community, first of all, to identify and tailor their recruitment or the recruitment approach to the specific obstacles that these women may face, because it's obviously going to be very different. Incentives might be a very good way to obviously get them to participate. However, despite that I had no incentive other than my own interest to join a clinical study, in my experience, I felt like a superstar. And that's because the team, the medical team, made me feel that way. From the way I was even provided a yellow card that said I was a VIP patient, and on the back it had emergency phone numbers, made me feel very comfortable that I had a good resource. I apologize, the room I'm in, the lights go off. But some of the advantages that I had going into the clinical study I can say I went into it with my eyes wide open for the personal reason that my father had suffered kidney, later metastatic to lung cancer, and lost his battle to it back in 2000. I saw my dad hospitalized for chemo treatments that were given to him every 8 hours. Later, they were just trying to find veins where to inject him, and he had lumps all over his body from the treatments. But this impressed upon me back in 2004 when I received a portacath, that again, a medical achievement had been accomplished already. And I was benefiting from that. The second advantage, which not everybody has, one of my coworkers was diagnosed before me, the year before me. And she gave me not only spiritual support, moral support. She was in HR, mind you, and she spent a lot of time making sure I was okay. And as a result of her example, I chose to follow in her footsteps by choosing the same medical team and the clinical study. And the result was she happened to be on the experimental arm of the clinical study. We're both here thanks to that, thanks to God above all, and thanks to our proactiveness. So another key component to clinical study are those clinical study nurses. They're instrumental in making you feel welcome. being there as a resource to you, and how they greet you alone can make a big difference. I can tell you an example. One of the times that Dr. Chesbro was going to be out of town, he made me aware that he was going to be out of town, that he was going to miss our follow-up. But he asked if another doctor could actually see me, and I said, sure. He said, Dr. Juan Herrada, who's MD Anderson trained, is going to be seeing you. I said, great, I'll do it. So I met Dr. Herrada for the first time, and probably the only time I've ever met him face to face. He examined me like normal. He went over my labs with me. And as all questions typical to a provider, he asked, do you have any questions? I looked him in the eyes and I said, yes, sir, please have a seat. He looked at the corner where that clinical nurse was standing, and she waved, yes, have a seat. And he sat down. I pulled out my yellow pad. I asked all the questions I had, and I started writing his answers. And when he left or we finished, he thanked me for that time and for the fact that I had asked him questions. I said, no, on the contrary, I want to thank you, but I challenge you to do that. Next time you ask the question to a patient, if they have any questions, please sit down. Give them your time and your dedication because they really need you. So in summary, really to me, without research, cancer treatments will continue to be very harsh on the body, on the men, on the mental health of patients, on the families of patients, financially and otherwise, especially if you're not insured or you don't have the resources. For Latinos, I think to arrive at the starting blocks that cancer presents, the decision to have treatment under a clinical study may just be seen as another hindrance, because we need to keep in mind that most of us, some of us anyway, have pre-existing conditions that really rule or already dominate our everyday lives. Will it be diabetes, arthritis, it can be heart, cholesterol disease. Any of these diseases already require a lot of labs, doctor's appointments, additional screenings, and potential candidates may not be aware that a clinical study is not more labs. It's still part of the treatment, and it's almost goes hand in hand. The education about that can be less cumbersome for them to consider joining a clinical study. To me, as a Latina participating in this clinical study, really helped, especially knowing that triple negative is so small in the large numbers of the types of breast cancers that we have, primarily, again, the hormonally driven cancers being in the majority. But education and myth busting, especially among our community, is going to be key. Because just like Ingrid said, as women, especially when you're head of household, you're the ama de la casa, you're looked at as a leader, and that role can be really hindered when you're not feeling so good, or when you look so pale, or you've lost your hair, or the cancer treatment is really taking you down from that role. So it's key that we must break down any and all barriers in order to increase participations of Latinas or Latinos in research. And like me, again, with no immediate family members, no BRCA genetic disposition, timely life-saving treatments and surgical options come as a result of research studies. And this can help all of us. Lastly, I want to make a personal note and a call out to, again, Dr. Chesbro. Earlier, I learned how you ladies are doing a lot of work in New York, and he was a New Yorker. He actually received his medical degree from the State University of New York Upstate Medical Center, and he presented about this clinical study in New York about 2 months before his passing. So to me, this presentation today comes full circle, and I want to thank you for that.
Yeah, thank you for sharing your experience. Like, it's in a very, very emotional journey, going through the clinical research, going through, the breast cancer itself. So I thank you so much for being so vulnerable with us today. I really appreciate you, being an open book and like letting us know your experience.
Thank you.
Yeah. And can we bring Ingrid back? I do want to ask one final question to both Ingrid and Maria. And we can start with Ingrid. What is one message you wish to share with everyone watching today?
I guess the key for me was to ask for support. And that's one thing that we as women, and especially a Latino woman, I think is hard to accept. And that vulnerability is what actually saved us. There's a lot of help out there. And we only just need to take our mask off, because we tend to be like showing just the good face. And when something like this happens, there's a lot of shame, there's a lot of guilt, and there's nothing farther from the truth. This is not a punishment for God. This is not something that you've done wrong. It's something that happens because we're human beings and we're alive. So just ask for help. There's tons of support there.
And I would just like to add, and I agree with Ingrid that that's very valid. There's such a human factor behind screening. Like I said, I spent 3 months screening to finding out where my cancer was located and the fact that it was a tumor and it was cancerous. We cannot lose faith. This is the one type of cancer that has multiple methods of screening. But above all, we are the first defense. No one should know our bodies better than us. And if you're not doing self-breast exams, if you're not noticing differences in your body to even skin changes, shape changes, discharge, whatever it may be, then you're missing the boat. You're only making things worse for yourself already. So again, the human factor behind screenings is not going to be, shouldn't be a deterrent. Insist, if your gut tells you something's going on, insist that you need to be heard. And until you do so, then continue, because that's what's necessary.
Yeah, and based on both of your testimonies, it seems like it wasn't in, family history. So it really, the statistic here I have is 85% of breast cancer occurs in women who have no family history. So like it really can affect anyone. And it's up to, you as the person, individual to go, get yourself checked out by an OBGYN or, self-examine. And, thank you both for sharing your experiences and joining us in this conversation. You both are incredibly resilient women. Thank you for being vulnerable, sharing, it's hard to share something as tough as this. So I thank you for joining us.
Thank you.
Thank you. Thank you for the invitation.
Okay, so many of us hope for a future without cancer or other serious illnesses. For that to happen, scientists and healthcare experts need data. That way we can continue researching ways to make better treatments and cures for these conditions. Like Maria mentioned, she was involved in a clinical, study, and it's because researchers need this data to continue making advancements. And since 2018, LULAC has supported the All of Us research program in its goal to help researchers understand about why people get sick or why people are healthy. We want to support researchers in efforts to understand how different genetic, lifestyle, environmental factors impact health and disease. This is called precision medicine. With this information, researchers can look to improve ways to diagnose, prevent, and treat health conditions such as breast cancer. With us today is a member of the All of Us research program, Lakisha Jones. Welcome, Lakeisha. I think you're on mute. Okay.
Hi. Hello, everyone. Thank you for having me this evening. It's a pleasure to be here. And, your stories are more common and familiar than you may even realize. Unfortunately, and I'm so happy to be here with LULAC and to hear the work that you're doing, because it is so critical. And the All of Us research program is a program that is really pioneering the next frontier of prevention, treatment, and care. The care that so many of us, our mothers, our fathers, wanted and deserved. And so many people have joined the All of Us research program with very similar stories of going to the doctor, of trying to figure out why all of a sudden am I sick, is I don't have a family history of this, or the physician is there and only has a partial health history. So many times I know my family as well, it's just not talking about some of these conditions, or not sharing if someone passed from a specific condition, or the knowledge just wasn't there. So these are some of the reasons why the All of Us research program came into existence. It's here to accelerate health and medical breakthroughs by using data, especially from populations that have not traditionally participated in biomedical research. As you hear from Maria and Ingrid, it comes through the research, it comes through the data, and the treatments and the care that we receive is based on information for those that have participated in research. So whether you are Latino, Latina, or Black, or young, a student, Native American, Asian, these populations have not traditionally been a part of the genetic sequencing process that leads to these biomedical breakthroughs and the development of treatments and drug plans. So I'm here today to, again, speak about why it's so important for us to get involved in biomedical research and understand what the All of Us research program actually offers. This program is very different for a couple of reasons. This research program is open to anyone that's over the age of 18. It doesn't matter if you do have a condition or you don't have a condition. It's a one-time enrollment in our program, and you actually get back your results. So many times in the research community, it's like you're coming in, you're taking information, they say thank you, and hopefully you'll benefit from it in the future. This program is committed to ensuring that our participants are partners. So not our participants, they are our partners in this. There's constant feedback from the minute that you come into the office to do the physical measurements, you get your information back. You can see it in your profile. If anything should come up from your genetic results, they let you know. If there's an opportunity for a researcher to study a condition possibly that you may qualify, they may reach out to you to participate further. So it's not a one-time, thank you for participating and moving on. It is continuous involvement in return of information, because with the information, then you can have a better understanding of what's going on with your body, what you may be at risk for possibly. And if something comes back that you may possibly be at risk for, it doesn't mean that you're going to possibly develop the disease, but you can have more informed conversations with your doctor. You can have more informed conversations with yourself about what it means to you and what it looks like in regards to diet and lifestyle and how you're living. And it also gives you the opportunity to have more informed conversations with your family members. You know, many times in communities, like, we're not talking about what someone may be facing. We have the brave face where we're holding it together for our families and not sharing and being vulnerable. And so this program gives us the opportunity, if something should come back, to have more informed conversations and ensure that you're getting all of your questions answered and possible solutions can be discussed. And that's for us specifically. What this program means, though, for our practitioners as well, is that it gives them information so they can make better choices in the medications they're prescribing and the treatment plans that are coming, that they have to offer to you. Without the data of populations that haven't been present that are serving in our program in Columbia University in the Washington Heights community, is that then, again, those that have participated in biomedical research, that is the information that they're able to offer forward. Unfortunately, there's so much research that takes place that our practitioners are not able to read every latest journal that's coming out and every piece of information. So this program here, by creating this large cohort and creating this large database, we can speed up that research. We can speed up some of the answers to get to the science that will actually be able to be offered then to me and to you, our family members, and literally like all of us in the grand scheme of things. And what this means, and also for our researchers, is that by this program, we have a data research hub that you can explore online that shows you how the information that this program collects on each of us is being curated and cleaned and being used so that researchers don't have to stand up their own research program. If there is a small community center or a small college in a small town that may not have access to the funding and the opportunities to conduct research, create these databases, be able to secure the information in a way that can really be longstanding and within the time that their grant may be awarded to them, they can access this database to conduct research and see patterns, not just in their small population that they're able to access, but 1 million individuals across the country by race, by gender, by age, by community. And then we can really have some strong information to make decisions and say, it's like, oh, look what's happening in this rural town. It's not just based on this one study or this small cohort, but we're seeing this pattern in rural towns or urban communities or suburban communities across the country. So the All of Us research program, it's multifaceted. It has so much to give back to us as individuals, as community members, and to our communities on our whole. And so we're here to let you know that the program is available. It is open to anyone that is interested in participating. All you have to do is go online and you'll go to joinallofus.org. If you're in the New York City area, joinallofus.org/NYC. And you can learn more about the program. You can learn how to enroll if you want to. But we hope that you'll participate in it and share it with family members and friends around the country. It's open to anyone. And so if there's a place that you can participate and sign up, or if it's not there yet, we welcome everyone to participate, because this is really the direction and the future and the promise that prevention, treatment, and care has for our healthcare system and for us as individuals in our health and wellness.
Thank you for sharing. I think Liz also dropped the link in the chat for anyone who would be interested in learning about joining the All of Us research program. It's available in the chat. And if Viviana, if you can share it also through Facebook, that would be appreciated. So thank you so much for sharing, Lakeisha.
Thank you.
And now I would like to introduce Stefania Acosta Ramirez, an engagement specialist with the National Network of Libraries of Medicine, who will be sharing a presentation on reliable health resources. There you go. Hello.
Okay. Hi, everyone. Thank you for coming today to this Cafecito, and thank you again to the panelists for this moving conversation. How Jennifer says, it's hard to share this kind of experience, right? It's very helpful for everyone that it's interested or is in that journey, because you can see that you are not alone, but even if your story is unique, you are together, we are together in this. Then how Jennifer say, my name is Stefania Acosta, and I represent the All of Us Community Engagement Center at the network of the National Library of Medicine. The National Library of Medicine is part of, the network is part of the National Library of Medicine. And I'm here to change you to understand why it's important to follow and find good health information. You can go next. When it comes to a life-changing event like cancer, it's very easy to feel overwhelmed, how our panelists were telling, because we have a lot of information and a lot of research is going on in the field. Then you need to find that information. And by example, when I Google phrases as cancer, breast cancer, and cancer prevention, I found a lot of data. You can go to the next. Then you can find millions of results. Then in our research that I did last week, if I look for cancer, I found 800 millions of results in a couple of seconds. And if I write in Google breast cancer, I'm going to find more than 500 of results. If I look for cancer prevention, I'm going to find more than 800 results of cancer information. You can go next. Then when we go to that information, using good health information, we want to make the best choices for our health, work with our health providers to make good health decisions, and help our communities to better understand important health topics. We, as the panelists said, we need to be advocates for our own health. You can go next. Then I'm going to talk with you about like some tips when you are starting that searching online to health information. When you start one of these journeys, or when you are curious about topics as cancer or other health topics, usually we go to a browser as Google or Bing or Yahoo, and we are going to find millions of results. Then my first tip is start with reliable health information providers. You can go to the government sites of the Medline Plus, resources that NIH have available, Research Institute as Mayo Clinic. A lot of these places have information in English and in Spanish. Then we are going to find both, and it's going to be helpful in our research. You can go next. Then you see that when we are looking for that information, you are going to see that you're going to find a lot. Then we need to try to use specific terms and advanced search is possible, if possible. Then try to write, ask your browser as you are asking a person, as the details that you want to know to go to a more accurate search in the browser. You can go next. And this is a very important point. Evaluate the source for reliability. Sometimes you arrive and you look for that information. And one tip is, if you find a place that it's not trustable, you're going to see advertisements. You are going to see that it's an update, that the last time that they post in that place was several years ago. That when you are looking to the information, looks more than opinion than a fact. Then we need to read carefully what we are reading. And if we evaluate this, we are going to find better information and more accurate and scientific information. You can go next. Then an example when we are looking for cancer. If we look for cancer, we are going to have 800 million results from all across internet. Or there may be even be ads. Some of them say ads in the browser, but others not. And by just adding the phrase NIH, which is the National Institutes of Health, I know all my results, and I can trust the top results are going to be from a reliable source. In fact, the top result is the National Cancer Institute, one of the world's leading research institutions on cancer. Adding a reliable organizations, as we saw before, like Mayo Clinic, CDC, NIH. I recommend to try and go to your browser in another moment and try to search for a health topic or breast cancer and try to add those keywords. And you are going to see how your search is going to improve. As well, you can change and add those sources as NIH. You can go next. Sometimes, at least for me, Google feels like an overwhelming place to start. Then I recommend resources to find health information. But I recommend medlineplus.gov. Medlineplus.gov, it's a database from Library of Medicine. And as experts in health information, NLM, curates and maintains Medline Plus. It's a completely free online health information resource. Medline Plus has thousands of health topics, including information on drugs and medical tests. And all the resources on these sites are designed for the public, so they try to present medical information in a way that it's easy to read. Each Medline Plus article links to trust resource across government and universities resource and websites, including National Institutes of Health and Nemours Foundation. You can go, and if you go to Medline Plus, you're going to find special sections about cancer and different kinds of cancer. You can go next. In this screen, I show you how Medline Plus is available completely in Spanish. Almost all the articles are translated, and you can change your version in the upper corner of the site, even in your mobile phone or even in the website. You are going to distinguish that the green one is in English, and if you are in the orange one, you're going to find all the information in Spanish. Sometimes you are going to find in the Spanish version information that they're going to tell you is only available in English, but you're going to find several languages. You can go next. And now I have an special invite for you, because now we are talking about this important topic, and we are going to watch this 1-minute video, and I want to invite you to watch party this video, to this movie that we are going to see. You can play the video.
Welcome to the dreaded sisterhood, the club you never wanted to be a member of.
I got a mammogram. They told me then that we saw something, and then I screamed for my mother.
And I felt this lump.
My second opinion oncologist wanted to treat me more aggressively than my original.
And then she scoops everything out. Exactly.
Well, I have to think about it.
He said, so let's just get this terminology correct.
We have breast cancer, not just you. This is both of us. I want you to understand it.
The word cancer is loaded. You immediately start thinking that she's going to die.
The core of Debbie is more than just a body part.
I look like my dad. But realistically, cancer took 8 friggin' years out of my life.
Okay, then we invite you to the free virtual film screening of the film Life Interrupted. We are going to have a watch party online. You can subscribe to the watch party through the link that it's on the screen and that we are going to share in the chat. And this time we are going to have the opportunity to watch the film online and to have a panel discussion, follow the watch party to talk more about our stories, our breast cancer stories, and how the research is important to understand what is happening and to find a better path in the future. Then thank you so much. And I want to thank you again, Ingrid and Maria, for share your own experience. Sure, it's not easy, but this show that we are all together in this, and it's an important part, and each unique story contribute to understanding the health outcomes of everyone. I give the word to Jennifer.
Hello, thank you for sharing a little bit about how to find reliable health resources, using those keywords, and then having accessible information in, multiple languages for people to, have access to this information for themselves. And now before we wrap up, I would like to ask everyone again to please scan the QR code. It'll pop up on the screen. Just open up your camera, put it on the QR code, and Liz is also dropping it in the chat. It's a brief survey. It's also about a minute. 3 or 4 questions, just kind of letting us know how we did today. If there's any feedback, please leave it in the survey. So I'll just give everyone a minute. Okay. Brett, this wraps up tonight's event. I hope you were able to learn how to attain reliable health resources. So thank you, Stefania, and learn the importance of representation in health research. As we learned today, breast cancer can really affect anyone, regardless of gender, race, class, and there are many barriers that affect Latinos, including language, immigration status, high rates of uninsured. This makes it hard to get an early diagnosis and seek the necessary treatments. It's important to participate in health research and join the All of Us research program. The All of Us research program has a special focus in engaging diverse populations, particularly communities that have been historically underrepresented. So racial, ethnic, sexual, gender. Lakeisha mentioned rural areas, older adults, those who have limited access to education, and many other groups. As we learned today, everyone has their own unique experiences. And with this data, researchers can learn more about the individual and their lifestyle, environment, genes, and how that can influence health and disease, which may lead to new precision and medicine discovery. So thank you, Ingrid, Maria, Stefania, Lakeisha, and lastly, the All of Us research program for joining us today for this important conversation. Thank you and have a great evening.